Okay, this is the central line dressing change. The first thing I'm going to do is verify medical order and the hospital policies on the procedure that I'm about to perform. And then I'm going to gather my equipment, which is the dressing change tray, my mask for me, and some clean gloves. I'm going to identify the patient with the two patient identifiers, name and birth date, and then explain the procedure to the patient. So we're going to take off your central line dressing, clean underneath it, and put a new one on. And I'm going to perform my hand hygiene with an antimicrobial hand rub at this point. Then provide privacy by bringing the curtain around to make sure I have a waste receptacle within reach, which is down here. And ask the patient about any allergies to skin adhesives and tape. And make sure the bed is at appropriate working height, which should be at about my elbows, but I'm trying to get this table over and it won't go over. This is too high. So to my elbows, bring them up to Fowler's position. Then, I don't know if I said this or not, if they have a pig line, have it extended away from their body beneath their heart. So I'm going to put my mask on. Get up close on this. Open my sterile tray. And grab the patient's mask. Close. Grab the patient's mask. Put that around now.
Where did you see that?
And I doubt this will stay, but yeah. Okay, so put the mask on the patient. And I'm not facing away from my sterile kit over here. And I tell them to, even though they have the mask on, look away from their side to the left anyway. And then bring my overhead table to a convenient location. And then stop their IV infusion if they have one for their CVAD. And then put the side slide clamp on it. And put my clean gloves on. I'm going to inspect around this side right here for any signs of infection or complications such as inflammation and redness and possibly heat if I can feel it. And I'm going to also note the presence and condition of any sutures around the side as well. And now I'm going to take off this old dressing from distally to proximally towards the actual site there. And I'm going, as needed, I'm going to hold this catheter right here. Stabilize it. I'm going to avoid touching underneath the old dressing. And once I get down here, this is where I'm really going to make sure I stabilize the catheter. Again, working proximally to the insertion site. Again, when I'm down here, I'm going to be stabilizing the catheter, and then through the whole thing. Okay, I'm going to discard this, my waste receptacle, on my clean gloves. And in between putting on my sterile gloves, I'm going to perform hand hygiene again with the antimicrobial rub. Put these onto the side and grab my sterile gloves. Okay, I'm going to put these on. And I'm not sure if you got a good view of the video, but in case you're wondering, my hand did not go over the sterile field created by the sterile glove right there. Okay, now I'm going to get the other one, put that on. The other. You don't have to. Okay, finally got those on. I'm going to remove this slightly. I'm going to bring all those sterile supplies onto the sterile field. Here we are. Now, I'm going to start out with the alcohol swab and clean any drainage away from the site that was underneath the dressing. This. And I'm not going to put my, wait, let's go. Okay. Now this hand's going to start being clean as soon as I touch this catheter down here. Going to clean off any drainage around the site. Working distally to any drainage that may be present. Okay. Now I'm going to get my chlorhexidine swab. I'm going to click the little butterflies so the chlorhexidine comes out. And again, I'm going to stabilize my catheter, scrub directly over the site, moving back and forth for 30 seconds. And once the 30 seconds is up, I'm going to start working distally from the site. Making a sterile area that is 2 to 3 inches in radius away from the central site, and I'm not going to wipe or blot as I'm doing that. And also I'm going to let it dry now, and I'm done with this. Back up. Dispose of that. I think it's dry verbalized everything. So it's directly over the insertion site. Scrub for 30 seconds, and I started working distally for an area of 2 to 3 inches on all sides of the insertion site, and then let it dry. Do not wipe or blot as I'm doing that. Okay, now I'm gonna use a skin protectant. Yeah, the skin protectant.
You can see it on the video.
I'm gonna hold it down here with the clean hand. Rip it up here with the sterile hand. There we are. Now I'm not going to put this directly over the insertion site, just around where I'm going to put my dressing. Okay. Now I'm going to get my actual dressing now, and I'm going to allow that to dry as well. Put directly over the site and center it. And a non-sterile pinky. Kind of move this catheter so I can center it a little bit better. There we are. Not directly over. There we go. Going to take the adhesive off now. I mean, not the adhesive, but the little liner. I'm going to run my finger behind it so it does not peel up on me. A little bit more to go. There we are. So I've done that. I'm going to grab a Sharpie, wherever one might be, and write date, time, and initials of the application right there. And then I'm going to grab no need to maintain sterile field anymore at this point. Tape. Secure the central line right here so it does not tug on the catheter. And really, I could have given this a little bit more slack. That would have been better, but for video's sake, don't leave it like that. Now, I'm going to start date, time, and initial of that dressing. Well, I missed a big step there because I did not have alcohol wipes in my skill set. It did not come with it. I'm not sure why. But before I put that dressing on, right after the skin protected phase where I wiped that on, I would have used the sterile alcohol swab and swabbed from the site all the way down and clean the lumen of the catheter. So that's what I would have done before I put on that site. And now at this point in the procedure, I would turn back on the IV infusion if it was running, and then unclamp it, and then get rid of all my supplies, dispose of them. This out. Raise the side rails of the bed, raise the side rails of the bed, raise the side rail. Put the bed all the way in lowest position, which it actually is in lowest position. Put the side rails back down. Bring the pole light within reach. Take off the gloves. And mask. Perform my hand hygiene with another antimicrobial hand rub, and then document the procedure.